What happens to Medicaid coverage in non-expansion states? Imagine facing a health emergency and wondering if you will have the coverage you need. That's a common concern for many seniors in states that haven't expanded Medicaid. In these states, Medicaid coverage stays more limited compared to states that have chosen to expand under the Affordable Care Act. These states have decided not to extend Medicaid eligibility to low-income adults who earn too much for traditional Medicaid but not enough to afford private insurance. This creates a gap where many people fall through the cracks. In non-expansion states, Medicaid usually covers fewer groups of people, like seniors, people with disabilities, pregnant women, and children. But for low-income adults who don't fall into these categories, they often don't qualify at all. This means many adults with modest incomes are left without any health coverage. They might earn just enough to be ineligible but not enough to pay for private insurance or get subsidies through the health insurance marketplace. Medicaid programs in these states tend to offer less generous benefits and cover fewer services. For example, they might not include extensive long-term care, dental, or vision services that are important for older adults. These states also tend to spend less money per person enrolled in Medicaid, which can limit access to comprehensive care. Instead of expanding Medicaid, some states relying on federal funds to help hospitals cover the costs of treating uninsured patients. These funds are meant for hospitals, not for providing direct health coverage to individuals. This approach can lead to more emergency room visits and worse health outcomes because people don't get preventive care or regular checkups. For seniors, this often means limited access to specialists or long-term care services that help them stay independent longer. Financially, non-expansion states face higher costs because treating uninsured patients in emergency settings is more expensive than routine or preventive care. Hospitals may struggle financially, which could lead to fewer services or even closures, especially in rural or underserved areas. This impacts everyone, but especially older adults who rely on local hospitals for their health needs. For retirees and seniors, the lack of Medicaid expansion can mean fewer options for long-term care and chronic disease management. Many older adults depend on Medicaid to help pay for nursing home stays or home health services. Without expanded Medicaid, they might have to pay more out of pocket or go without needed care. This can increase the burden on families and caregivers who step in to help. In short, Medicaid coverage in states that have not expanded the program remains limited and less comprehensive. Many low-income adults and seniors find themselves without adequate health coverage. This can lead to worse health outcomes, higher costs for hospitals, and more challenges for older adults trying to stay healthy and independent.